If your cardiologist has mentioned you might need an angiogram, you need to hear this before you agree to anything. Because here's what most doctors won't tell you. There's a very specific type of patient who truly needs this test, and a much larger group who are having it done for reasons that have nothing to do with saving their life. The difference between these two groups could mean the difference between a procedure that protects your heart and one that simply protects someone's bottom line. I'm not here to tell you to ignore your doctor. I'm here to give you the information you need to ask the right questions, because when it comes to your heart, understanding what's actually necessary versus what's just routine could be one of the most important conversations you ever have. Let's start with what an angiogram actually is, because if you don't understand the test, you can't make an informed decision about whether you need it. An angiogram, also called a cardiac catheterization, is a procedure where a doctor threads a thin tube called a catheter through a blood vessel in your wrist or groin, guides it up to your heart, and injects a special dye that shows up on X-rays. This lets them see the arteries that supply blood to your heart muscle and check for blockages. It sounds straightforward, and in skilled hands, it usually is. But here's what matters. This isn't just a simple test like checking your blood pressure. It's an invasive procedure. There are risks, even if they're small. And more importantly, what happens during that angiogram often leads to more procedures, whether you actually need them or not. The risks, while generally low, are real. There's a small chance of bleeding at the insertion site, damage to the blood vessel, allergic reaction to the dye, kidney problems from the contrast material, or, in rare cases, a heart attack or stroke triggered by the procedure itself. For most people, these risks are minimal, but they're not zero. And when you're talking about a test that might not change your treatment or outcome, even small risks deserve careful consideration. Now, before we go further, I want to be crystal clear about something. There are people who absolutely need angiograms. If you're having a heart attack right now, an emergency angiogram can save your life. If you have severe chest pain that suggests unstable angina, meaning your heart isn't getting enough blood, and you could be headed for a heart attack, an angiogram is appropriate. If you've tried medications and you're still having significant symptoms that limit your daily life, checking your arteries makes sense. These are the scenarios where the test has clear, proven value. But here's where things get murky, and this is what I really want you to understand. There's a growing number of people, particularly seniors, who are having angiograms done as a kind of screening test. Maybe you had some chest discomfort, or you got short of breath walking upstairs, or a stress test came back abnormal. Your doctor says, let's just take a look and see what's going on in there. It sounds reasonable, it sounds cautious, but this is where you need to pause and ask some very important questions, because what seems like careful medicine might actually be setting you up for a cascade of interventions you don't need. Think about it this way. You're 70 years old. You've noticed you get a little winded when you climb the stairs to your bedroom, something that didn't bother you 5 years ago. You mention it to your doctor during your annual checkup. They order a stress test. The test shows some minor changes. Not dramatic, not obviously dangerous, but not completely normal either. Suddenly you're sitting in a cardiologist's office and they're scheduling an angiogram just to be safe. This is happening thousands of times every day across the country. Here's why. When a cardiologist does an angiogram and finds a blockage, even a moderate one that isn't causing you any real problems, there's enormous pressure to do something about it. This is where stents come in. A stent is a small metal mesh tube that props open a blocked artery. Sounds helpful, right? The problem is that multiple large studies have shown that in people with stable coronary artery disease, meaning they're not having a heart attack and their symptoms are mild or controlled with medication, stents do not prevent heart attacks, and they do not help you live longer compared to medication and lifestyle changes alone. Let me say that again because it's important. If you have stable blockages and you're not in immediate danger, getting a stent will not reduce your risk of dying or having a heart attack. What it will do is create a moment of relief for both you and your doctor, a sense that something has been fixed, but that feeling of security might be false. You'll still need the same medications. You'll still need to make the same lifestyle changes. And you'll have a foreign object in your artery that requires ongoing monitoring and medication to prevent clots from forming around it. So, why are so many angiograms still being done? Well, we need to talk about something uncomfortable but true: the financial incentive. In many healthcare systems, procedures pay significantly more than spending time talking to patients about diet, exercise, and medication management. An angiogram followed by stent placement can generate tens of thousands of dollars in revenue. A detailed conversation about lifestyle modification generates a modest office visit fee. I'm not saying every cardiologist is motivated by profit. Most doctors genuinely want to help, but the system they work in is designed to reward procedures, and that creates a bias, often a subconscious one, toward doing something rather than watching and managing conservatively. There's also something called the oculostenotic reflex. It's a term cardiologists use, sometimes jokingly, to describe a real phenomenon. If you see a blockage, you feel compelled to fix it. It's human nature. Once that catheter is in place and the images show a 70% narrowed artery, it feels wrong to just pull out and do nothing, even if the evidence says that's often the best choice for stable patients. The doctor sees a problem on the screen right in front of them. They have the tools to address it right there in that moment. And walking away feels like ignoring something urgent. But urgency and importance aren't always the same thing. Now, I know what some of you might be thinking. If there's a blockage, why wouldn't you want it opened up? Isn't it better to be safe than sorry? This is where we need to understand a little bit about how heart attacks actually happen, because it's not quite as simple as you might think. Most people imagine that a heart attack happens because an artery gets more and more clogged over time, like a pipe filling with rust, until one day it's completely blocked. But that's not usually how it works. Many heart attacks are caused by what doctors call a vulnerable plaque, which is a softer, less stable buildup that might not even be blocking much of the artery. This plaque can suddenly rupture, form a clot, and completely block the artery in a matter of minutes. Meanwhile, that 70% blockage your doctor found on the angiogram might have been sitting there quietly for years, with your body developing small detour blood vessels around it, and it may never cause a problem. Here's the fascinating part. The blockages that cause the most dramatic problems on a stress test or angiogram often aren't the ones that cause heart attacks. The blockage that's been narrowing slowly over years has given your heart time to adapt. Your body has actually grown tiny new blood vessels around it, called collateral circulation, that helps supply blood to that area of the heart muscle. It's one of the remarkable ways your body compensates. But that softer inflammatory plaque that's only blocking 30 or 40% of the artery, that one can rupture tomorrow and cause a massive heart attack. And opening up the big blockage you can see does nothing to prevent that. This means that opening up the blockages you can see doesn't necessarily prevent the heart attack. You can't predict. What does help prevent heart attacks across the board? Medications like statins that stabilize all your plaques, blood pressure control, quitting smoking, exercise, managing diabetes, and eating in a way that reduces inflammation. These approaches work on every artery, not just the one or two that happen to look worst on an X-ray. So, when does an angiogram actually make sense? Let's get practical, because I don't want you leaving here thinking you should refuse all testing. An angiogram is appropriate if you're having a heart attack or if doctors strongly suspect you're about to have one. It's reasonable if you have severe symptoms like significant chest pain with minimal activity despite being on optimal medications. It can be valuable if non-invasive tests like a stress echocardiogram or a cardiac CT scan suggest you have very high-risk blockages in critical areas, like the left main coronary artery, where intervention actually does improve outcomes. And it might be needed before certain other surgeries if you have multiple risk factors and concerning symptoms. But if you have vague symptoms, if your stress test was only mildly abnormal, if your chest discomfort is inconsistent or not clearly related to exertion, if you're otherwise feeling well and functional, this is when you need to have a serious conversation before proceeding. Here are the questions you should ask your cardiologist before agreeing to an angiogram. First, what are my symptoms and how much are they limiting my life? Be honest with yourself and your doctor. Are you genuinely unable to do things you need to do, or are you just noticing you're not as young as you used to be? There's a difference between being unable to walk to your mailbox without severe chest pain and simply feeling a bit more tired than you did a decade ago. Age brings natural changes. Not every change is a medical emergency. Second, have we tried optimal medical therapy? This means the right combination of medications at the right doses given enough time to work. This typically includes a statin, a blood pressure medication, possibly aspirin or another antiplatelet drug, and medications to control symptoms if needed. If you've only been on treatment for a few weeks, it might be too soon to say it's not working. Many heart medications take time to show their full benefit. Your body needs to adjust, and the medications need time to do their job at the cellular level. Third, what did my non-invasive tests show, and what is my actual risk level? A mildly abnormal stress test is not the same as a high-risk result. Ask your doctor to explain not just that something was abnormal, but how abnormal and what that means for your specific situation. Was it a small area of your heart that showed changes? A large area? Did the changes happen early in the test or only when you were at peak exertion? These details matter enormously. Fourth, and this is a big one, if you find a blockage during the angiogram, what will you do? And does the evidence support that approach for someone like me with my symptoms and situation? Some centers have a policy of see it, fix it, but that's not always best practice for stable patients. You want to know the plan before you're sedated on a table with a catheter in your artery. Will your doctor be willing to just look and gather information? Or are they planning to place a stent the moment they see a significant narrowing? Fifth, what are my alternatives? Could you try medications first and see how you respond? Could you work with a cardiac rehabilitation program? Could you optimize your lifestyle factors and retest in a few months? Sometimes giving conservative treatment a genuine chance means committing to it for 3 to 6 months, not 3 weeks. And finally, what happens if I don't have this test right now? Sometimes the honest answer is that nothing bad will happen if you take some time to think, get a second opinion, or try conservative management first. If your doctor can't give you a clear, compelling answer to this question, that tells you something important. Now, let's talk about what you can do instead of rushing into an angiogram, because there are genuinely effective strategies that don't involve threading catheters into your heart. If you have coronary artery disease or you're at risk for it, the foundation of your care should be medical management and lifestyle modification. That might sound boring compared to a high-tech procedure, but the evidence is clear. For most people with stable disease, this approach works just as well and avoids the risks and costs of invasive procedures. Medical management typically includes a statin medication to lower cholesterol and stabilize plaque, blood pressure medications to keep your numbers in a healthy range, and possibly aspirin or another medication to prevent clots. These drugs have been proven in massive studies to reduce heart attacks and save lives. Are they perfect? No. Do they have side effects for some people? Yes, and those need to be managed. But the benefit for most people is real and substantial. A statin doesn't just lower your cholesterol numbers. It actually changes the biology of the plaque in your arteries, making it more stable and less likely to rupture. That's protection that works around the clock in every artery in your body. Lifestyle modification means the things you've heard before, but maybe haven't fully committed to. It means moving your body regularly. You don't need to run marathons. A half-hour walk most days of the week has powerful effects on your heart. When you walk, you're not just burning calories. You're improving the function of the lining of your blood vessels, reducing inflammation, helping your body use insulin more effectively, lowering your blood pressure naturally, and literally training your heart to work more efficiently. It means eating more plants and less processed food. That doesn't mean you have to become a vegetarian overnight. It means choosing an apple instead of chips for a snack. It means adding vegetables to your dinner plate and maybe reducing the portion of meat. It means cooking at home more often where you control what goes into your food. Small, sustainable changes add up over time. It means managing stress, getting decent sleep, and if you smoke, stopping. Sleep is when your body repairs itself, including your cardiovascular system. Chronic stress keeps your blood pressure elevated and promotes inflammation. And smoking, well, if you smoke and you have heart disease, quitting is probably the single most powerful thing you can do. It means maintaining a healthy weight if possible. I know none of this is easy, especially if you've been living differently for decades. But these changes work on a fundamental level that no procedure can match. They address the root causes, not just the visible consequences. There's also cardiac rehabilitation, which is a structured, supervised program of exercise and education. If you have heart disease, you may be eligible for this. And it's covered by Medicare. The research shows it improves symptoms, exercise capacity, and quality of life. Yet it's dramatically underused because it's not as quick or dramatic as a procedure. Cardiac rehab gives you expert guidance, a safe environment to exercise with medical supervision, and education about your condition. It's one of the most evidence-based interventions we have, and most people who qualify never do it. Here's something else worth knowing about. There's a newer type of CT scan called a coronary calcium score and coronary CT angiography. These are non-invasive ways to look at your heart arteries without threading anything into your body. A coronary calcium score tells you how much calcified plaque you have and helps estimate your risk. A CT angiography uses a dye injected into a vein in your arm and can actually visualize your coronary arteries fairly well. These tests aren't right for everyone, and they have limitations, but they can provide valuable information without the risks of a traditional angiogram. If your doctor is recommending an invasive angiogram, ask whether a CT angiogram might give you the information you need. It's not appropriate in emergency situations, but for stable patients being evaluated for possible coronary disease, it can be an excellent middle ground. Now, I want to address something important. Some of you watching this might have already had an angiogram and a stent, and you might be feeling worried or upset. Please don't. Medicine is not black and white. Your situation may have been exactly the kind where intervention was appropriate. And even if, in hindsight, there might have been other options, you made the best decision you could with the information you had at the time. What matters now is that you stay on your medications, follow up with your doctor, and take care of yourself going forward. This video is about helping people make informed decisions for the future, not about creating regret about the past. What I want you to take away from this is not fear or distrust of your doctors, but empowerment. You have the right to understand what's being recommended and why. You have the right to ask questions. You have the right to seek a second opinion. You have the right to take time to decide, except in true emergencies. The best medical care happens when you and your doctor work together, when they explain their thinking clearly, and when you feel comfortable speaking up about your concerns and preferences. If your doctor becomes defensive or dismissive when you ask thoughtful questions, that might tell you something important about whether this is the right physician for you. A good doctor welcomes informed patients. They appreciate questions. They understand that you're trying to take responsibility for your health, not questioning their expertise. Your heart is precious, and protecting it is absolutely important. But protecting it doesn't always mean doing more tests and procedures. Sometimes it means being thoughtful, asking questions, and choosing the approach that truly serves your long-term health rather than just providing short-term reassurance. To bring this all together, angiograms are valuable, potentially life-saving tests when used appropriately. If you're having a heart attack or you have severe, unstable symptoms, you likely need one. But if you have stable symptoms or only mildly abnormal test results, you deserve a thorough conversation about your options before proceeding. Medications and lifestyle changes are powerful tools that work for the vast majority of people with coronary artery disease. The fact that they're less dramatic than a procedure doesn't make them less effective. In fact, for many people, they're more effective because they address the disease throughout your entire circulatory system, not just at one or two spots. Ask questions, understand your specific situation. Know that it's okay to try medical management first. Know that you can ask for time to think, except in genuine emergencies. And know that being an informed, engaged participant in your healthcare is not being difficult or distrustful. It's being wise. I hope this has given you a clearer picture of when angiograms are truly necessary and when they might be optional. My goal isn't to scare you away from needed care. It's to help you have better conversations with your doctors and make decisions that are right for your unique situation. I'd love to hear from you in the comments. Have you been advised to have an angiogram? What questions did you ask? Or what do you wish you had asked? What's been your experience navigating these kinds of medical decisions? Sharing your experiences can help others who are facing similar choices. And if you found this information helpful, consider subscribing so you don't miss future videos where we cut through the confusion and give you clear, practical health information you can actually use. Take care of your heart, take care of yourself, and remember that you have more power in these decisions than you might think.